Hi everyone, welcome back to my channel. I hope you're all doing wonderful. If you see me first time, my name is Yana. I'm one of the nursing students at one of the universities here in Queensland. I'm finishing my second year now of Bachelor of Nursing Science. Technically I already finished it, I just have my placement I had now left in December and I'm all done, and then I have one more year left to finish my whole degree. So many of you asked me to film a video for you guys showing you what nursing books I have used throughout my Diploma of Adult Nursing and also throughout my uni degree. I apologize for not filming this video earlier. I've been really busy. I took 4 subjects this semester, which is semester 2 of year 2, and it was very intense for me. And as many of you know who've been following me now for a while, I do work at the same time as I'm doing my full-time studies, so you can imagine how high is my load. But now I'm finished with all my assessments. By the way guys, I've got for my last assessment for health, law and ethics subject HD, which is high distinction mark, which I'm so happy. Like, I'm not the best student out there, I will tell you. I have varieties of different marks. I have credits, I have distinctions, I have high distinctions, I have passes as well. Like for example, I didn't have overall passes yet, but I had 2 passes throughout this year 2 of my degree for 2 different subjects, for 2 different assessments. It's not the overall grade for the whole unit, for the whole subject, but they will be grading you for each assessment. Like, you will have, let's say, a unit and you will have 3 assessments or 2 assessments for that unit and 1 quiz, for example. So each assessment or each quiz will have a grade. So yeah, so for my last grade now, I've got HD for law. Like, come on, law, it's not even one of my favorite subjects. I'm more into sort of like a clinical and medicine subjects, not the law. Although as a health professionals, of course, we have to know the law and all the codes of conduct, you know, ethics as well, regulation, legislation and things like that, because this is what we bound by when we provide cares, you know, and work in a healthcare industry. But like, it's not really something interesting for me to do. So for my not the first one actually, first one we had a quiz. The second assessment for this unit, I've got I think I've got, like, it was 55% or something like that out of 100. So that would give me sort of like a pass or a credit, pass or a credit. The teacher said to me that I needed to use more acts, you know, like I needed to use more legislation. So I took a feedback for my previous assessment and I've done this last assessment, you know, which was a mental health. Again, something that I know I'm not going to be working in because I'm not really interested in mental health, but the scenario was all around mental health, so we needed to find acts, you know, regulations and stuff like that related to mental health, you know. And yeah, so I've done pretty hard work because I wanted to just pass, you know, like I was not hoping to have high mark. All what I wanted is just for this subject to pass, because I was so frustrated for the mark of my first one or the second assessment that in my head I just wanted to pass and I would be happy for that, you know, and things like that. Yet I worked hard just to pass, you know. And then, like, I've got the feedback from the teacher saying that I've done a really good job, you know. I've related the scenario to right acts, you know, I've picked the right legislation, you know, and things like that. I've opened up the topic, I addressed all the issues, you know, and I provided good solutions and things like that, you know. And I was like, oh my god, really? I was so happy. It's just when you have good marks, like not just good marks but high marks that you're not always expecting for, it just gives you such a boost to go on more, you know, like to continue. It gives you strength to continue your degree, to work even harder, to do even better job for your future assessments for other subjects and stuff like that. It just gives you courage, you know, and that sort of like self-esteem, you know, to continue. So yeah, so that was like Oh, I was so happy. So yeah, so this is my second HD. The other one I've got last semester for health and alterations subject. I've got credit or a distinction, and the other one was HD, which was really cool as well. But health and alteration subject is one of my favorite subjects. You know, this is where you do the assessments. This is your sort of like a clinical hands-on subject. So yeah, so yeah, guys, I'm talking now about the Bachelor of Nursing Science, not about diploma at TAFE. So yeah, so I'm so pleased. Now I have to finish my placement, and yeah, and I will be off for this year. So let's get back to books, because I can mumble a lot. Okay, so the books that I'm going to show you now, the first lot, are the books that I've been using through my TAFE diploma of enrolled nursing, and what I've been using as well through assessments through my Bachelor of Nursing degree. Although some of the books that I have here are already outdated in terms of referencing, because for referencing they will tell you can either pick a book that is no longer 5 years old or no longer 7 years old. Most of the times it goes like no longer than 5 years old. My ones are longer, like they're older than 5 years old. So I was looking at the clues in it, but I was not referencing these books. I still needed to go to either a library to get a latest edition, or an edition that would be within that 5 years old, you know, or use the online resources that provided by our uni, which I'm going to mention later on as well. Okay, so this bunch of books been gifted to me by one of the nurses that works with me at the place where I work now. Okay, the first book is this one. It's called Wound Care Manual. I have a 6th edition. I believe they already have 7s by Caroline Carville. This one is perfect for you to study different types of wounds and different types of dressings. It's very well illustrated book. You can find a lot of pictures, especially here in the middle. Like I don't want to show all the pictures because maybe YouTube will ban my video, but it's really good book in terms of information regarding the wound types and how it works for the skin layers as well. It comes to pressure, when it comes to pressure sores, you know, ulcers, you know, discharge that comes out from the wound and things like that. So if you can, it would be nice for you to have this book when you do your wound management. I believe it was in semester 2 of your diploma of internal nursing. This book will become really handy. If not, the library at TAFE, as I remember, had a few books there to borrow. Like the disadvantage that I probably mentioned in my previous videos as well, that library of TAFE and library of unis, usually they don't have a lot of samples of books, okay, which is unfortunate because we have so many students. And when it comes to assessment times, everyone rushed to the library to borrow the books, you know, and the samples, the number of samples, you know, of the books is very low. So this is really like, it's uncomfortable. So like in a worst scenario, if you can't get this book, just go earlier a little bit to the library. Like if you know the date of your assessment, you know, just go prior to that, maybe by 2 weeks. If you can get the book, you know, get the materials done. You can take your phone, screenshot the materials, you know, I mean, like take the photos of the materials from the book and then return it for the other students to use. But if you can't, the great place to buy your books is from Facebook Marketplace. Facebook Marketplace is very great place to buy your nursing books from. Used condition, still yet in, like it's used but it's in a good condition. Sometimes it goes almost halfway down in price, especially if it's not the latest edition but the edition before it, but yet still in a 5 years time frame, so you can still use that book for reference in it for your assessments. So yeah, Facebook is a great place to buy your books, but you have to be quick, because once the book comes on, something that is very in demand, something that is very popular, it goes quickly like that. So you have to be really quick, you have to be constantly checking if you're looking for a particular book. Okay, so this was the first one. The second one was gifted to me as well by the nurse. It's Essentials of Law for Health Professionals, third edition by Kim Forrester and Deborah Griffiths. So this one, I wouldn't say that you would be using it too much throughout your degree, but it was gifted to me for free, and I did use some materials from it when I was doing my law second assessment for my Bachelor of Nursing Science. So this book is handy somehow, but yet I wouldn't recommend it buying it. This is just my personal preferences. But yeah, if you can find it in a good price somewhere, like something not expensive, then yeah, like you can use it. Okay, second one is Nursing Interventions and Clinical Skills. My one is very old. This is 4th edition. I believe it's 2007 or something. I'll let you know now. Yeah, this one is 2007. Obviously you can't use this one for referencing, but yet this one is a great source of information. Apart from minor changes, you know, that here and there appear now in a healthcare system, you know, but as a basic information, it's still very valid, and you can find a lot of useful stuff in here. This one is by Alkin, Perry and Porter. Okay, the newest editions you can also find if you go to TIFE, if you do your Diploma of Enrolled Nursing. We have a bookshop. It's usually somewhere near to canteens. You can go there and you can buy books from there. So they have the latest editions of this one. They have a wound care book in there, you know, they have all the nursing books in there. They also have anatomy and physiology general books, you know, pathophysiology and stuff like that, law obviously, you know, and they have drug books as well. They sell it in a full price because books there are new. Okay, so like if you don't want to bother yourself by looking online in different websites, you know, if you don't have time, for example, you can just go and buy it there from that shop. Because when I was checking during my Diploma of Enrolled Nursing, the prices in the shop comparing to the prices online, if you buy it from Amazon or eBay or from any other online websites that selling or specializing on books, it's pretty much the same. So if you want to like save time for yourself, just go and buy it from the shop. Okay, so this one is really good. This one has a lot of assessments. It goes in like sections. Okay, so it has infection control management, hygiene, basic human needs. So if you're going through your first semester, for example, and you will be placed into aged care facility for your first placement, obviously things like hygiene, looking after residents, you know, providing their ADLs, you know, daily living activities, including showering, feeding, you know, washing them and things like that, changing people, you know, things like that. So you will find a lot of information here, you know, also infection control for you as a healthcare provider, how to promote infection control when you're providing cares to your residents or to your patients. Also it has a lot of assessment skills like vital signs, you know, because you will be doing your vital signs when you will be on your aged care facility placement. Lab tests, you know, if you need to collect UA test, you know, and send the sample to lab, you know, you will need to look at the stick to see, you know, as a baseline if there's any indications for UTI for that resident. So peripheral nursing care, wound care, managing immobilized clients, managing complex nursing interventions. Then you have palliative care here, gastric intubation, promoting oxygenation, fluid electrolyte and acid-base balance, urinary elimination and things like that. So it will take you from your semester 1 to your semester 3 throughout your already clinical placements, which will be for you in hospital settings. So this book is really, really good, and I take a lot of information from it for my own knowledge. Next two books I find pretty much, I would say, essential through your diploma or through your degree, because they do have a lot of information. Although, again, if you want to use books for reference, and then you have to get something that is within that 5 years frame. If you want to just have something for yourself, for your own knowledge, that you will be just reading for yourself and not referencing for your assessments, that you can get something like I have, because these ones go cheaper. The older the edition, the cheaper the price goes for it when it comes to used books. So my first one is Porter and Perry's Fundamentals of Nursing. You probably have heard this many times if you already started your diploma for general nursing. This one is the 3rd edition by Jackie Crisp and Catherine Taylor. This one is, I'll tell you which year is this one. So this one is 2009. Okay, and this one has a lot of information for you. It has assessments, it has explanation as well, why that assessment is performed. It has section for critical thinking. It has planning for nursing care, nursing diagnosis, which is really cool. I like to read that section. Evaluation when you do your assessments, you know, how to evaluate the outcome. Ethics and professional practice, so it has a little bit of law section in it, which you will be touched in your Diploma of General Nursing and also in your Bachelor of Nursing Science as well. Communication with the patients, their families, and between colleagues. Client education, this one is really important as well, because we as nursing professionals or healthcare professionals, we have to know how to educate our clients, and it's one of our responsibilities to educate them. Okay, how to do your documentation when it comes to progress notes, you know, and documenting other things as well. So yeah, it has a lot of sections here. Safety, hygiene, skin assessments and things like that. Second one is Medical Surgical Nursing by Lewis's Medical Surgical Nursing by Di Brown and Helen Edwards. This one is in 3rd edition for me, which is, I believe, the same year as the previous one. Yes, it's 2012. This one is so nice. I've used this one so much when I was doing my assessments for we had a pulmonary assessment. We had a pulmonary case. Someone had edema or something, on bronchitis. I don't remember now 100%, but I've used this book as indication of information for myself, because the difference between older editions and the newer one is very light. So I took it to see if I can find the information in here, and when I found the information, I needed to go to the library of my uni to get the latest edition or the edition before latest to use it as a referencing. But in terms of information, this book is just beautiful. It's absolutely beautiful. It has so much of information for assessments and management and evaluation and nursing interventions and everything you can imagine. And it explains to you how the body works in terms of certain disease when you perform certain assessments of that person when they have certain disease or conditions. You know, it explains to you also how the body works and why this or that assessment has to be performed, you know. So yeah, I really like this one. So if you can get this once, you know, somewhere from Facebook Marketplace, you know, in a cheaper price, a little bit older edition, that would be great for you in terms of information. All the books that I showed you now here, I will list them in the description box below, because it might be hard for you to see the cover of the book when I'm turning. As you can see, the books are massive. They're like maybe 5 kilos or 10 kilos each, so big they are. So yeah, that's why all the names I will list for you in the description box below. Now I want to show you some of the books that I bought in op shops. This is the second place where you can buy books as well. I would not say to you or promise that you will find the books in op shops that would be like even 7 or 10 years old. Usually the books that I find, you know, when it comes to nursing, they're really old. But I buy books, if I buy something really old, that would be either pathophysiology or anatomy or physiology, because things like that do not dramatically change, because this is our body, and I think like scientists already discovered most of the things of our, like, about our body in terms of anatomy and physiology, so it's not many changes there. But when it comes to nursing practice, every year we come up with better solutions. This is why a lot of books will be made in different editions, you know, newer editions every year, you know, just because there are new ways being found that been having a better outcome than the ones that have been used before. You know what I'm trying to say when it comes to nursing practice. So yeah, so I will show you now what I bought from op shop. Okay guys, so This is the first book. So this one is a Human Anatomy and Physiology. I bought it for $2. So this is the book. I literally paid $2 for it. I still have a tag. I didn't remove it. This one is by Elaine and Marieb and Kaja Hoyne. I think if I'm pronouncing that right. It's 8th edition. I don't think you will be able to find this book anywhere because I literally, as I said, I bought it from Op Shop. I will try to find which year it is, but I think it's very old. Oh, there you go. This one is actually 2010. It's not very old, but as any anatomy or physiology book, it gives you detailed information about every piece of your body, literally. You know, how does it work? As you can see, someone who owned this book before was highlighting. Actually, I'm the person who likes to highlight as well. I like to highlight certain parts of the book that sound interesting to me when I read, because if I want to find something later on, I just go and I find it easily. So yeah, so I really like things like that. So for anatomy and physiology, go to your local op shops if you live in Australia, you know, and you can find ridiculous prices for the books, you know, to pay for. Next one is Essentials of Human Anatomy and Physiology, as well by the same author, but this one is 10th edition. And this one is 2014. I'll show you how it looks like. Looks like that. I don't remember how much I paid for this one because I think I took the price off, but literally like they don't go more than $5. Like literally, like they would go like $2, $3, $4, $5. That's it. You won't pay more, maybe depending on the area though. So yeah, so this one is quite nice too. It has a lot of illustrations in it, the muscle system. So it basically goes through all the body systems and then goes in details within each body system. So I really like this one. Next one is Pathophysiology. This one is so heavy. I have car spacing. This one is so heavy. Okay, some people who've been using it had here bookmarks. So this one is 8th edition, Concepts of Altered Health States by Carol Madsen-Porse and by Glenn Matfin. I'll show you the year. Oh, it has a CD in it as well. I even forgot that it has a CD. This one is 2009. To be honest, guys, I didn't check if this CD is still in a good condition. It's still packed, but like it's literally still glued. I think nobody opened it when they've got this book. Nobody been using CD, but if you're a person who still uses a CD, if you find a book like that in op shop, definitely you can use that. Okay, this one has a lot of illustrations in it as well. I'm sorry guys, it's really hard to lift it up because it's so heavy, but yeah, I don't know how much I paid for this one, but again, I believed I paid about like not more than $5. So yeah, so this is that. Next one is Oxford Handbook of Clinical Skills in Adult Nursing. This one is by Jacqueline Randall, Frank Coffey and Martin Bradbury. This one is which year is this one? Just trying to find. This one is 2009. Okay, this one has a lot of assessments in it, nursing interventions as well, and a little bit of evaluation. Okay, this one I can't use it for referencing, of course, because it's too old, but it's very good for general knowledge. Okay, I really like it, and it's handy. It's very small. You can take it with you if you want. You know, it has a lot of assessment, like for example oral suction, how to do the oral suctioning, recording peak flows, what else, changing a tracheostomy tube. This one you will do a lot when you do your Bachelor of Nursing Science, because ENs don't do it but RNs do it. Then regulation of IV infusion rates. Oh, this one is tricky. I always had problems before with changing IV rates and calculating it. Changing a peripheral IV cannula dressing and things like this. This one is really good. Assessing pain, you know, how can you assess pain? You know, there are different assessments types for pain depending, you know, if people can speak or can't speak, if it's a child or an elderly person and things like that. So yeah, so I found this one just by luck in one of the op shops. Now I want to show you books that I read for myself. Okay, they have a little bit of medicine in it, it has a little bit of nursing in it, and it just has sort of like a general health knowledge. How can you look after your body, you know, how your body works, what's best for your body in terms of sport, nutrition, you know, rest and things like that. So I'll just show you what I read by myself, and I will tell you where I've got those books from. Okay guys, I put all my books back again here on this small chair because I have to swap the piles of books. They are so big, so I could be easily reaching it for you. So the first one is sort of like a vintage book, and when I say vintage, I mean vintage because it's really old. So this one is a home guide to health and medicine, the Macquarie Home Guide to Health and Medicine, by, who is the author? Warwick Carter and Jan Bowen. It probably doesn't mean anything to you because literally this book is just so old. This one is 1993. It was published in New South Wales. But these books gives you here the life cycle section, basic anatomy and physiology, symptoms, interventions, disease, treatments, and then other areas. So the most one that, like the main one that I like is the symptoms of the disease, okay, and then explanation and investigations of the disease. I went through this book like roughly through the sections, but I think I've read by now about maybe, here's my bookmark, where is it? So I've read 30 pages now. This book, what I found so far, is very good in explaining how your body works. The first section that I'm reading now is about pregnancy, how your body works through the pregnancy, you know, why you have certain pains, you know, what's happening in your body, what each and every symptom is related to, and why you have it and things like that. And I really like it. So this is just for my own knowledge. So as you can see, the one that I'm reading now is pregnancy and birth. The one that I finished, the life cycle. Okay, so I really like it. It's really good book. It's even a little bit dirty here. Yeah, so it's written in really clear English, very easy English, easy to understand, easy to read, and I really enjoy reading it. The next book is vintage as well. This one is a complete home medicine guide, the Royal Australian College of General Practitioners. I'll show it to you here. I don't have the covers anymore for it to show you how the cover would look like. I think it's been too old that the people took it off, because I bought it as well from op shop. So this one by Dr. Chris Del Mar and by Dr. Simon Murray. This one is, I'll tell you which year is this one. 2000, so it's like 20 years ago. God. 20 years ago. This one I haven't started reading it yet, okay, but I've been going through it a little bit here and there. So this one is explaining medication type in classes, you know, and how it's related to certain conditions in your body and things like that. It's a really good book. It has a lot of illustrations in it. I love books with illustrations because gives you some sort of, you know, an idea in your brain when you look at the picture. So yeah, so it explains to you certain disease, you know, and things like that. So I really like it. I believe that interventions in both of these books would be a little bit maybe outdated, but yet there will be it will have a nice base, because I mean, like, even 20 years or 15 years ago, like, everyone knew, like, if someone having a temperature, it's a defense function of your body when you have certain viruses or bacteria, you know, so it's fighting, and everyone know what you have to do when you have a temperature. So this is just like a simple example. So the solution will be there still, probably the same up to what we have now. It's just nowadays we have more sort of like new technologies coming in, you know, new ideas coming in, new trials, you know, coming in. So this is why we always like find some new solutions, you know, in terms of treatment options, you know, and intervention, nursing intervention and stuff like this. But yeah, it still has a good core base in these books. But what I like the most about it is that it gives you a description of disease and what this disease do in your body, you know, when you have it, you know, because this is sort of like a medical or clinical point that is mostly interesting to me when I read this type of books. Now, next one is again disease. This one is so cool. I like this one. This one, disease free, proven ways to help prevent more than 75 common health problems: headaches, heart disease, high cholesterol, osteoporosis, stroke, skin cancer, and many more. Alzheimer's, arthritis, back pain, cataracts, colds, diabetes. This one also explains to you each disease and how can you prevent it using traditional methods, like using herbs, using certain nutrition, using certain ways of exercise, and of course using medicine as well. So I really like this one. This one is I'll tell you which year is this one. I bought it in op shop as well, 2010, this one. Okay, so things like that you can find in op shops. I think I paid $4 for this one. Okay, the next one is The Human Body in Health and Illness. Okay, this one is 4th edition, and this one is, I'll tell you the year, is 2011. Okay, this one is good as well, because it talks about your systems of the body, disease, and how they affect your body, and they talk about some treatment options as well. So it's really good. I like it, and it has a lot of pictures. Okay, don't know how much I paid for this one. Some of them I took the stickers off already, but yeah, this one was from op shop as well. Now, this one I bought from op shop about a year ago, and I read already half of it, and my kitten bit a corner from it, so I needed to cut it off because it was lying down on one of the shelves downstairs, and he bit, as you can see, there are still some holes he left from his teeth, but this one was chewed up. So this one is A Medical Medium by Anthony William. If you've been following Anthony William on Instagram or on YouTube, you probably know. The whole pile just lie down. You probably know who this guy is. I'm not going to be talking about the, you know, all the details of where he gets his knowledge and things like this. Some people believe about the spirit that he's getting the knowledge from. Some people don't believe, you know. So I'm not going to be going about that. That's his own life. That's his own choice. But the information that he provides in the books is very nice. The other book I have from him is Detox. I think it's called Liver Detox or Detox. Something is about detox. It's a red cover. That one I have in PDF file. I read it as well, but I didn't read the other one as much as I read this one. This one I went already halfway through. He's talking about here a particular virus that invades your body and how it affects the systems of your body, and I find that it's really good book. He talks here about solutions, what you can eat to prevent and get rid of that virus, you know, and what conditions that virus can lead to. So yeah, it's quite interesting. I mean, like, we all have rights to our opinion, I guess, right? Nowadays, like, everyone have an opinion. You can disagree or agree with certain publications, but for me this book is really nice, and I bought it from op shop, and I think I paid like $2 for it. It was a ridiculous price, but this one is not that old. I'll tell you the year of it. It's still on Amazon, and I believe he sells it on his website as well. So this one is, which year is it? 2015. There you go. so 2015. It's just 5 years ago, so not that long. Okay, and the last book I bought in Saudi Arabia, this one is Islamic Medicine, The Key to a Better Life by Yusuf Al-Hajj Ahmed. Okay, this one I bought in, did I buy it in Mecca or did I buy it, I think I bought it in Mecca. Yeah, it was one of the bookshops. No, hold on, I bought it in Medina, that's right. I bought it in Medina, near to the Prophet's Mosque. It had a big bookshop. They actually had few bookshops in there, so I bought this one from one of those bookshops. Okay, this one is in English. Okay, what I like about this one, I've read almost half of it now. What I like about this one, it goes through different type of disease and how can you cure it by using different herbs and different foods. Okay, which is really nice. I really like it. I like traditional medicine. I like medical medicine, you know, use of certain medicine, you know, like drugs and stuff. And I also like traditional medicine because I believe that herbs, you know, certain foods, you know, lifestyle can do changes to your health conditions. You can work it can work together by using drugs and using traditional medicine. Like, I'm not denying any of that, not just because I'm working in the nursing field. No, it's just, this is my own perspective. But this is why I do believe on the other side that traditional medicine can make effect to your body conditions. This is why I like to buy books like that. So this one, because it's Islamic medicine, it's written from perspective of what Prophet Muhammad was doing, to, like, not what he was doing, but how he was treating himself and what he was advising to other people in terms of treatment, of using certain, you know, herbs, or using certain drinks, you know, or certain seeds or foods. So this one is really nice. They provide a little bit of hair physiology, you know, when they talk about certain conditions, you know, to give you an idea of what that condition does to your body, you know, and when you treat it with certain things, you know, what exactly does it do, so you could have that sort of like an idea how does it work. This one I paid, I think it was $35, yeah, something like that. In Saudi Arabian money, I think it was, I don't remember how much I paid in Saudi Arabian money, sorry guys, it probably won't make any difference to you anyway, but in dollars it cost me like about $35. 35 bucks is a bit expensive in my opinion, you know, but if you compare it like to nursing books go like 100 and 120 bucks, you know, $80, $90, that's the prices for the new editions, you know. But if you want to buy something for yourself to read, you know, any books, even here in Australia, when it comes to health, when it comes to medicine, they go like high in price. So yeah, but I really like it, and I love to bring items from overseas. When I go somewhere overseas to different countries, I always tend to buy something, even if it's a little thing, to bring it home, you know, and just keep it as a memories of that place that I've been there. You know, every time I look at it, you know, I have that beautiful feeling associated with the memories of that trip. So yeah, so for this one, this item, I can even read it, you know, so it's not just looking by it, I can use it, I can get good benefits out of it by getting good information, you know, that can benefit my body. So yeah, I really like it. So guys, this is all for this video. Probably it's been too long, I don't know how long it's in minutes now, but I think it will be like half an hour or something. But this is the books that I use. One more book that I forgot to mention, and it's Harvard Nursing Guide to Drugs. This book I did not buy, although your teachers will advise you to buy it throughout your diploma for general nursing, and they may advise you to buy it through your Bachelor of Nursing Science. But why I didn't buy it? First of all, when I was through my diploma for general nursing, okay, I was going through the Facebook marketplace. I wanted to find the edition that was before the new one back then, you know, so I could pay a little bit less money, and every time I would go and find someone who listed, it's been already gone because I was too busy, I was working and studying, that I never could catch the fresh ad, you know, where the book would be still available. So I missed it so many times, and then I just gave up, you know, and then my placements kicked in, you know, so again I was too busy. So I was using my nursing guide to drugs from the library. for my assessments and stuff like this. But then when you go on your placement in the nursing drug room, you will have either MIMS or you will have Harvard, okay, Nursing Guide to Drugs. All the hospitals, pretty much all the hospitals where I've been to, they had one of these books. Like MIMS usually most of the time pretty much there, because this is one of the most common one. You know, also when you will be doing your assessments in labs during your diploma of general nursing, when you need to provide administer medication to your clients or to the mannequins on a bed, you know, and you don't know the medication class or type, what it's used for and things like that, you can grab MIMS in labs. We at TAIV had about like 5 or 6 MIMS available in labs. You can grab it and look it up, you know, see what the medication is for, if your teacher asks you, you know, or even for your own knowledge. As a nurse, you have to know that before you give any medication to the patient, you need to know what that medication is for. You need to roughly know at least its side effects as well, you know, and things like that, route of administration, even though it will be stated to you in order, but still for your own knowledge it's better to have that information. Okay, so yeah, so I was just going through my diploma of general nursing just like that, like I didn't have my Harvard and I was all right. Then when I went to uni, okay, so at uni, this is something that I forgot to mention, good that I remembered now. So at uni, the good thing about uni, particularly about my uni, is that we have learning resources on our student database and we have reading resources. Learning resources is when they're giving you certain links to the websites that provide information. They will give you videos there, they will give you PDF files, and I'm talking about teachers who provide for you this information. So this one is very similar to TAIV Connect when you have learning resources as well. But then at TAIV we have, at uni we also have something called reading resources. Reading resources is a different part of your student database where teachers will scan for you latest editions of the books. They're not going to scan the whole book apart from, for example, Harvard Nursing Guide to Drug. This one is scanned completely. It's there for, it's not in the reading resources. I'm sorry, I just remembered now. Harvard is on university library database. You will find the whole book is scanned there for free. You can access it. You don't need to have any password apart from your password as a nursing student of that uni. But then in the reading resources, what the teachers will be doing, they will be scanning for you, for example, Lewis's Medical Surgical Nursing, certain chapters of it. Like, for example, if you studying this week cardio, or if you're studying pulmonary disease, if you're studying let's say diabetes, so they will find a section in a book teaching you about that type of condition, about its assessments, diagnosis, interventions, and they will scan to you the whole chapter, including the front page of it, where you can see the front name of the author, you know, and then they will scan for you the front of the book as well. So if you want to reference that book and you don't have access to the library, or you didn't find the book, physical book in a library, you can use the online version, that piece of scanned materials that they provide for you for taking information from it and referencing as well, because they will have all the information for you scanned there in terms of writing it for your Harvard style referencing if you have it in your uni. You know, we have a Harvard style referencing. Okay, so that's for that. So pretty much if you're in a uni, a Harvard Nursing Guide to Drugs will be listed for you there in your library database. All the other books like this will be listed for you in certain sections. So pretty much for every week you will have section of the book representing information related to that topic of that week. So if you want to use it for your assessments, you can do it, which is really cool. This leads me to the point that sometimes you don't need to buy certain books, because at uni we have these reading resources. You know, at TAIV we didn't have reading resources. We needed to go to the library and try to grab be lucky to grab the samples of the book if any left